everyone, welcome to the AAFE Training Center. My name is Crystal and I'm here with one of my patients and we're going to be doing her Botox treatment today. Come on in, take a closer look. Obviously you can tell that she's very young and beautiful, so we basically just do neurotoxin on her every 3 to 4 months to kind of prevent any kind of further wrinkling. So the areas that we're treating on her are her frontalis, so go ahead, raise your eyebrows for me. So not a whole lot of movement, but again, young, and we're just trying to do it preventatively. Her glabella, so make your angry face. Wonderful. And then the only other area that really bothers her is her chin. So do like a little sad face. So this mentalis muscle right here that tends to crease up and kind of create that orange peel appearance to the skin. So that's all we're treating on her. She's getting a total of 28 units, which really isn't all that much. It's what we call nowadays like baby Botox, which is perfect for her because she's young. We're just trying to do it preventatively. And honestly, I have found that the younger my patients start, the better off they are. So I'm having quite a few people come in their early to mid 20s and starting earlier and earlier. So I'm all for it. If it means they won't get crazy wrinkles as they age. So I'm just getting her cleaned up. She's not wearing any makeup, so I'm just cleaning her with alcohol, make sure she's good and sterile. And then I'm going to mark her with a dry erase marker just to kind of help me map out exactly where I want to inject. So raise your eyebrows for me, relax. I'm just kind of marking where I see movement. Obviously staying at least a finger away from the brow because I don't want to drop her brows or create any kind of heaviness. Raise your eyebrows again. Relax, make your angry face. Perfect, and then your chin one more time. Kind of just going right into the center of it. Perfect. Okay, so I'm giving her 8 units across her forehead. 4, 6, 8, 10, 12. I have like 14 dots on my forehead. So typically what I like to do is add a little bit of saline to the syringe so that I can push 1 unit per injection, like 1 unit of volume. So I have 8 units of neurotoxin in here. I'm going to add saline down until I have 14 units of volume so that I can push 1 unit per injection so that it's evenly treated, but I'm still only giving her that 8 of neurotoxin. So 14, come straight out, and then that one will be good to go. All right, so let's go ahead and get started. Ready?
Yeah.
Okay. So obviously you can see I have her marked up. I am not going through my marker. Everyone tends to get a little hung up on that, but it's just there to kind of help me know where I want to place my product. So you can see I'm just going either right below or right next to my dot. Turn a little bit towards me. Perfect. That way I know where I left off and where I need to go. Two more, turn that way a little bit. Wonderful. All right, coming down to the glabella. She's getting 16 units here, so we're just gonna do 4 in the procerus and then 4 in the medial corrugator, and I'm only giving 2 in the lateral. So common dose here is usually like 20 units, but we're just giving her 16. And then we're gonna come down to the chin. So these injections are deep and usually straight in, just 2 of them. So I'm just gonna go like right above my dots, making sure I'm staying medial. If you come too far lateral, you have a chance of hitting the DLI, which is responsible for pulling your bottom lip down when you smile. So if I come too far out and I inject here, she's gonna look a little funky when she smiles. So always trying to stay very medial and keep that injection right there. So 2 more little pokes. Perfect. So now I'm just gonna get her cleaned off. So wiping away your dots is just as important as your injection technique, and it's just as important as patient education. So always wiping up and away from the brow, up and away within the glabella, and then the chin, I kind of just wipe like right within the muscle. I don't wipe out. So her instructions are to not touch or rub for the next 4 hours, and do not raise your body temperature. So anything that's gonna make her sweat, whether it be working out, going for a long walk in the sun, a hot tub, sauna, anything like that, we don't wanna do for 4 hours. And that's it. We've pretty much figured out her dose. She gets the same dose pretty much every time you come, every 3 months. So I will probably see her back in 3 months for her next treatment. And that's it for today. Thanks for watching, everyone.